Hello everyone, Assalamualaikum, peace be upon all of you. This is Hana again, and we are back after taking a couple of days off due to Muslim holidays, Eid. We're back to our um, Journey to the Top session that is PNLE, Philippine Nursing Licensure Exam Review, and tonight we are going to focus on the foundation of professional nursing practice. And since this is just like the preliminaries part of our review, we're going to use we're going to use practice mode, and we have these 100 questions to complete. So to begin, reading the instruction, questions and choices are randomly arranged. The answer is revealed instantly after each question. There's no time limit for the exam. So as much as possible, hopefully we can finish within the 1 hour time span because that is the goal that we have in order to think critically fast in a limited amount of time. All right, question number one. Ensuring that there is an informed consent on the part of the patient before a surgery is done illustrates the bioethical principle of autonomy. Yes, that is correct. The explanation is that informed consent means that the patient fully understands about the surgery, including the risks involved and the alternative solutions. In giving consent, it is done with full knowledge and is given freely. The action of allowing the patient to decide whether a surgery is to be done or not exemplifies bioethical principle of autonomy. That is correct. And now let's proceed to the next question. Nurse Betty is assessing tactile remedies in a client with pneumonia. For this examination, Nurse Betty should use the ulnar surface of the hand, finger pads, fingertips, dorsal surface of the hand. If we are assessing for fremitus, I think we're going to use the ulnar surface of the hand, but I'm not sure about that. So let's see. It is correct. Now, the nurse uses the ulnar surface or the ball of the hand to assess tactile fremitus, thrills, and vocal vibrations through the chest wall. When we do the assessment, we use this ulnar surface like almost near your wrist if you're familiar, because we are assessing for fremitus for like vibration when we get the patient to talk. So the fingertips and finger pads best distinguish texture and shape. The dorsal surface best feels warmth. So the dorsal surface, the opposite side of your um of your hand, this one, like the darker side out there, the outer side, we use it to assess for temperature, for warmth. And for the fingertips, as well as the finger pads, we use them to distinguish texture and shape. In case of like nodules, that we use fingers at those kinds of times. Now, let's proceed to the next question. Which of the following item is considered the single most important factor in assisting the health professional in arriving at a diagnosis or determining the person's need? Okay, take note, we're talking about the single most important factor in assisting the health professional. Okay. Okay, so we have diagnostic test results, history of present illness, physical exam, biographical date. We're talking about the single most important factor, so we have to weigh in everything. It could be, I'm doubting between diagnostic test results and history of present illness. Because history and present illness is the current complaint of the patient, and diagnostic test results identify the laboratory values. So I think um, arriving at diagnosis. Because the thing is, the history of present illness is the complaint of the patient, whereas the diagnostic test results, what it does is that it verifies the complaint of the patient. It provides the exact values. So we're going to read the question again. Single most important factor in assisting the health professional arriving at diagnosis. Okay, let's try history of present illness. But I don't feel confident about it because I feel like it's also this one, but let's try this. Oh wow, it is correct. So the history of present illness is the single most important factor in assisting the health professional in arriving at a diagnosis or determining the person's need. That is true because that is the current situation of the patient. Now, Nurse Hazel will administer a unit of whole blood. Which priority information should the nurse have about the client? Okay. Unit of whole blood. Take note of this. We're talking about whole blood administration. Height and weight? No. Calcium and potassium levels? No, although it has something to do with the hydration status. Hemoglobin and hematocrit levels? Yes, because this is very important to determine how much amount of blood we will administer to the patient. Oh no. Right, blood pressure and oh my goodness. That's right, blood pressure and pulse rate. The baseline must be established to recognize the signs of anaphylactic or hemolytic reaction to the transfusion. That is true. It's my mistake to not consider this before clicking that one. I didn't realize that, when you actually click it, it actually like submits the information, your results immediately. So our score is 75% at the moment. We've got one mistake now. So I'm expecting more mistakes, but as we go on further, but as those mistakes go on, hopefully we can learn further as well, but hopefully not. I mean, hopefully we get more of it correct. The doctor orders hourly urine output measurement for a postoperative male client. The nurse Trish records the following amounts of output for 2 consecutive hours. Okay, for 8 a.m. we have 50 ml, 9 a.m. we have 60 ml. So, based on these amounts, which action should the nurse take? So before we identify which kind of action should the nurse take, we have to first and foremost identify whether 50 ml and 60 ml are normal or does it belong to the normal output rate of urine. So for this one, if I remember it right, 30 ml is the normal output rate, but I'll try to Google it. Okay, per hour. Be patient with me because I'm trying to review. Okay. Yeah, that's right. It's 30. Accordingly, 30 ml is a normal output of urine. We need to find out about the range. It doesn't give normal urine output per hour, the range, but if 30 was a normal output, if 30 ml was the normal output, I believe that 50 and 60 ml are still perhaps in the normal. But 50 and 60 ml is already too much, so it could be that the patient is already losing too much fluid. Now, from that baseline data that we understand, which action should the nurse then take for that kind of urine output for 2 hours? Increase the IV infusion rate, irrigate the indwelling urinary catheter, notify the patient, continue to monitor, and record urine output. Okay, so the thing is, the patient keeps losing fluid. If we increase the IV fluid infusion rate, we get to sustain the body, but at the same time, it's not an intervention for that kind of increased urine output. Irrigating the indwelling catheter is not very connected to the situation. Um, this one, continue to monitor. No, I don't believe this one. We have to do something about it. This is, remember, post-operative male client. We're talking about post-op. Let's try notifying the physician. Okay, it's wrong. So, oh, I see. So 60 ml per hour is normal. So normal urine output for an adult is approximately 60 ml per hour. Therefore, the client's output is normal. Beyond continued evaluation, no nursing action is warranted. That is true. So our issue here, the problem that we identify here is that uh, we thought that the normal output of urine is 30 ml per hour, but it's actually 60 ml per hour. You know, and um, at arriving at this kind of information, so we thought that it's 30s, but I found some formula online actually. It doesn't really provide you with an answer because you have to compute it also using like kilograms. 60 ml. So we have to really, really find it. It should be greater than or equal to 0.5 ml per kilogram per hour. But we cannot really tell. Yeah. Okay, so we consider the average weight of the patient. So post-operative male patient, it has to be like um 60 or beyond kilograms. The total, I mean, I the urine output varies per person depending on the weight and our patient. It says here we only have this post-operative male client, and we assume that 60 kilogram is the uh, normal urine output for adult. Now, let's try another one. If a central venous catheter becomes disconnected accidentally, what should the nurse in charge do immediately? Central venous catheter becomes disconnected accidentally. So we're talking about the IV line, okay? What should the nurse in charge do immediately? Call another nurse, call the physician, clamp the catheter, apply dry sterile dressing to the site. Okay, I think we have to clamp it first because it became disconnected, so it'll keep on flowing. Let's try. Okay. If a central venous catheter becomes disconnected, the nurse should immediately apply a catheter clamp if available. If a clamp is not available, the nurse can place a sterile syringe or catheter plug in the catheter hub. Therefore, if we do that, we can be able to stop the flow of the IV catheter. After cleaning the hub with alcohol or povidone iodine solution, the nurse must replace the IV extension and restart the infusion. Yes, that is true. Once it has been disconnected, we have to replace it. We should not use it again because, once again, inside it is sterile. Okay. Let's try another one. Alhamdulillah. Nurse Trish must verify the client's identity before administering medication. She is aware that the safest way to verify identity is to check the client's identification band. No, this is not the safest way. I mean, it is, yeah, a good one, but you have to ask the client first, right? State the client's name out loud and wait for a client to repeat it. Check the room number and the client's name on bed. No, ask the client to state his name. This is the best way to verify the client by asking the name. Oh no. Well, I'm not sure where this came from, but But this is what I learned from school. The safest way and the best way to um verify the client's identity is to ask the client to state his name, because if the client's identification band can be mismatched with others, it can happen. This client, if you state the client's name out loud and wait for the client to repeat it, um therefore the client can just lie about it and just say yes about it. Check the room number and client's name in bed. The name tags of the bed can actually interchange with others. And so I think this is the safest way, but let's read the rationale. Okay, checking the client's identification band is the safest way to verify a client's identity because the band is assigned an admission and isn't be removed at any time. Okay, so that is noted. If it is removed, it must be replaced. Asking the client's name or having the client repeated his name would be appropriate only for a client who's alert, oriented, and able to understand what is being said, but is not the safe standard of practice. Names on bed aren't always reliable. That is true. That is very true. I agree with this. Asking the client might be the best way to verify, but it's not the safe standard of practice. So we learned here that the client's identification band is actually the safest way because it is attached to them since the admission. The nurse is aware that the most important nursing action where a client returns from surgery is, okay, most important nursing action when client returns from surgery is assess the client for presence of pain, apply dressing for drainage, assess the Foley catheter for patency and urine output, assess the IV for type of fluid and rate of flow. So for the pain, I mean, returning from surgery, having pain is pretty much normal, right? I mean, you're having wound, you're being opened up, so the pain is normal. Assessing the dressing for drainage. This, I think, is the most important because it is, the types of drainage that we have may indicate infection, such as if you have serosanguineous drainage, if you have serous drainage. So the normal one that we have is actually sanguineous because or serosanguineous, is that it? Or purulent drainage. Oh, those are indicative of infection. So I think this is the best one. But let's see what it says here, the rationale. Okay, so it's the pain. I should not have overthink about that. Assessing the client for pain is a very important measure. Postoperative pain is an indication of complication. The nurse should assess the client for pain to provide for the client's comfort. Okay, once again, let's erase that kind of mindset. I mean, yeah, that's important. Dressing is just like number two to the pain. Pain is number one. But earlier, the reason why I said pain is pretty much normal in surgery is because recently we had this clinical instructor that said, like, pain, if a client continuously complains about pain over and over again, it is pretty much normal. You just have to administer um, painkillers because you went to surgery and you were cut up. You were opened up, so pain is pretty much normal. But once again, we have to assess the client for presence of pain because so much pain can be indicative of complication. So it is very, very important to do that. We have 50% score now. Okay, in preventing the development of an external rotation deformity of the hip in a client who must remain in bed for any period of time, the most appropriate nursing action would be to use trochanter roll extending from the crest of the ilium to the mid-thigh, high abductor pillow, footboard pillows under the lower legs. Okay, so we're talking about external preventing the development of external rotation. Okay, deformity of the hip. Okay, the client, take note, must remain in bed in a long period of time. I'm not pretty sure about this, but I'll try this one. Okay, trochanter roll. That is true because it provides resistance to the external rotation of the hip, the trochanter roll. I wish I could show you how a trochanter roll look like. I'm actually Googling right now, but the thing is, I'm only screen recording for this tab, so I don't know how to screen record using also including other tabs. Anyway, trochanter roll, it's just like a mini yoga mat that is being rolled, so you don't really have to worry about it. At least you know the function. Okay, which instruction should Nurse Tom give to a male client who is having external radiation therapy? Which instruction should Nurse Tom give to a male client who is having external radiation therapy? The thing is, I'm getting distracted right now by my phone, so I really need to keep this away. Oh dear, where did this come from? How come there's this ink over here? Oh, what's the matter? My printer, my ink for the printer is leaking. So I have inks all over now. But again, back to review, avoid distractions. Which instruction should Nurse Tom give to the patient who is having external radiation therapy? Like, if we talk about external radiation therapy, we're actually talking about stuff like x-rays, like that. Okay. Apply lotion or oil to the radiated area when it is red or sore. Wash the skin over regularly. Eat, uh, oh, by the way, external radiation therapy could also be therapy for cancer. Okay. 3 to 4 hours before treatment, protect the irritated skin from sunlight. So, I'll try this one, okay? Okay. So, irritated skin is very sensitive and must be protected with clothing or sunblock. The priority approach is the avoidance of strong sunlight because we're talking about the radiation therapy here. So, the irradiated skin, accordingly, is very sensitive because you have your cells destroyed there in the radiation process. Okay, now, which type of medication order might read vitamin K? Okay, this is good. We can actually zoom this out. Okay, which type of medication order might read vitamin K, 10 milligrams, iron daily, 3 times a day? Okay, I mean, by 3 days. Standard written order. No, this is not a stat order. Stat means immediately. I'm not sure about standing order and single order. So I only know about standard written order and stat order, but I'll try this. Okay, so standard written order. This is a standard written order. Prescribers write a single order for medications given only once. Okay, single order is only a medication given once, such as painkillers. Okay, I understand. So that's what a single order is. Okay, a stat order is written for medications given immediately for urgent client problem. A standing order, also known as protocol, establishes guidelines for treating a particular disease or set of symptoms. In special care, such as the coronary care unit. Okay, I actually got it now. Because, a standing order is like when your doctor recommends for you to do chemotherapy. So that is a standing order. Of course, he has to write a prescription on that. He has to write a medical order with chemotherapy in order for you to be transferred there. So that is called a standing order. And single order is the medications given only once. And stat is for urgent client problem. Okay. Facilities also may institute medication protocols that specifically designate drugs that a nurse might not give. So this is again a standard written order. The reason for that, we have here the vitamin K. This is a generic name. We have a lot of brand names available for vitamin K. Accordingly, the dosage is 10 milligrams and the route is IM, intramuscular, and the administration daily, and the duration is 3 days. So it's complete. It is a standard written order. So this is how prescriptions actually look like. Okay, we're already taking too long. We've actually been here for about 25 minutes, and we're only at at the 12th question. Okay, we're taking too long. It's okay. Nurse Amy has an order to obtain a urinalysis from a male client with an indwelling urinary catheter. The nurse avoids which of the following which contaminate the specimen. Okay, can we take a break briefly? Let's take a break. And we resume again. Okay, so we're talking about this question that we left off earlier. Nurse Amy has an order to obtain urinalysis from male client with indwelling urinary catheter. The nurse avoids which of the following which contaminate the specimen. Okay, so which of the things of the choices here contaminate the specimen? Okay, obtaining the specimen from the urinary drainage bag, wiping the port with an alcohol swab before inserting the syringe, clamping the tubing of the drainage bag, aspirating a sample from the port of the drainage bag. Okay, so take note. Wiping the port with an alcohol swab before inserting the syringe. This is good. Clamping the tubing of drainage bag. So yeah, it's good because it protects it from spilling. Now we're up to two choices. So obtaining specimen from urinary drainage bag and aspirating sample from the port of drainage bag. So if we aspirate sample, that is safe because we're using a syringe. But if we obtain a specimen from the urinary drainage bag, that drainage bag is quite, you know, we're talking about contamination of the specimen. Okay. Is it from port? Oh, it's about obtaining the specimen from urinary drainage bag. So a urine specimen is not taken from the urinary drainage bag. Urine undergoes chemical changes while sitting in the bag and does not necessarily reflect the current client status. That is true. That is very true. So when we have to undergo diagnostic tests, such as urinalysis, we should not take the urine specimen from the urinary drainage bag because there are already chemical changes there. So if you want a urine sample for urinalysis, you should definitely get a fresh urine from the patient. So in addition, it may become contaminated with bacteria from the opening system. That is true. So next up, alhamdulillah. Okay, this one. Nurse Michelle hears the alarm sound on the telemetry monitor. Telemetry. I have to make myself familiar again with this one. Okay, telemetry, automatic measurement, wireless transmission of data from remote sources. Oh, I see. Is that so? Okay, because it's the first time that I encountered actually telemetry. I'm not sure if it's been taught in our school, but Philippines, we've got very poor technology. Monitoring refers mechanisms representing measurement data. Okay. Therefore, you can monitor the data even if you were, in a remote area. So that's telemetry monitor. The nurse quickly looks at the monitor and notes that a client is in a ventricular tachycardia. Yeah, now we are back to our review. I took a break earlier. Okay. So the nurse quickly looks at the monitor and notes that a client is in ventricular tachycardia. The nurse rushes to the client's room. Upon reaching the client's bedside, the nurse would take which action first? Okay, take note, we have ventricular tachycardia. Check the client's level of consciousness. Yes, that's the first thing we determining unresponsiveness is the first step assessment action to take. When a client is in ventricular tachycardia, there is a significant decrease in cardiac output. However, checking the unresponsiveness ensures whether the client is affected by the decreased cardiac output. Okay, Nurse Oliver is caring for a client with impaired mobility that occurred as a result of a stroke. The client has a right-sided arm and leg weakness. The nurse would suggest the client use do the following assisted side devices. Quad cane. Okay, I see. Crutches in a walker can be difficult to maneuver for a client with weakness on one side. A cane is better suited for a client with weakness of arm and leg on one side. However, the quad cane would provide the most stability because of the structure of the cane and because the quad cane has four legs. Okay. Nurse Ron is assisting with transferring a client from the operating room table to a stretcher. To provide safety to the client, the nurse should secure the client's safety belts after transferring to the stretcher. During the transfer, the client, after surgical procedure is complete, the nurse should avoid exposure of the client because of the risk for potential heat loss. Hurried movements and rapid changes in the positions should be avoided because these predispose the client to hypotension. That is true. At the time of the transfer from the surgery table to the stretcher, the client is still affected by the effects of anesthesia. That's true. Therefore, the client should not move self. Safety belts can prevent the client from falling off the stretcher. Nurse Amy has documented an entry regarding client care in the client's medical record. When checking the entry, the nurse realizes that incorrect information was documented. How does the nurse correct this error? No, we don't cover it up completely. No, we don't use correction fluid. No, we don't erase it. Yeah, we draw one line to cross it out. To correct an error documented in a medical record, the nurse draws one line through the incorrect information and then initials the error. Okay, now back to it. Nurse Betty is assigned to the following clients. The client that the nurse would see first after endorsement. Okay, this is talking about priorities. A 63-year-old post-operative abdominal hysterectomy client of 3 days whose incisional dressing is saturated with serous fluid. B 34-year-old post-op appendectomy 5 hours complaining of back pain. A 26-year-old client dehydration 44 MI. Oh no. Who are we going to address first? This one, appendectomy, is infection, so let's try. It's wrong. It's nausea. It's an symptom of impending myocardial infarction. Yeah, thought so too, and should be assessed immediately so that treatment can be instituted and further damage to the heart is avoided. The nurse prepares to administer the cleansing enema. What is the most common clinic position used for this procedure? Supine, prone, Sims left lateral, lithotomy, enema. Mm, it seems left lateral, okay. Oh, because it allows gravity to aid the flow of fluid along the curve of the sigmoid colon. If the client cannot assume this position or has poor sphincter control, the dorsal recumbent or right lateral position may be used. Supine and prone positions are inappropriate and uncomfortable for the client. When Nurse Trish is providing care to his patient, she must remember that her duty is bound not to doing any action that will cause patient harm. Okay. When Nurse Trish is providing care to his patient, she must remember that her duty is bound not doing any action that will cause patient harm. This is the meaning of bioethical principle, non-maleficence. Do not cause harm, do any action that will cause any harm to the patient. To do good is called beneficence. Nurse Oliver must apply an elastic bandage to client's ankle and calf. He should apply the bandage beginning at the client's. Okay, I kind of remember this because we had a return demonstration in this one back then. So I'll try to recall how it is done. Um, do we begin at the calf or do we begin at the foot? If I remember it right, we begin at the calf. Okay, we have ankle, foot, lower thigh, knee. Calves. Um, okay, let's try it. Calf. Calf is, yeah. Foot, it's the opposite, okay? An elastic bandage should be applied from distal area to proximal area. Wow, okay, that is true. This method promotes venous return. In this case, the nurse should begin applying the bandage at the client's foot. Beginning at the ankle, lower thigh, or knee does not promote venous return. Okay, I understand now. The nursing theorist to develop transcultural nursing theory is, oh my gosh, I forgot it. I think it's Callisteroy. No, it's Madeline, right. Madeline Leininger developed theory of transcultural theory based on her observations. Okay. Florence Nightingale is about hygiene. Callisteroy is about health-seeking behavior. Was that it? It has something to do with it. Or is it poverty? And Madeline Leininger. Reason why Callisteroy I'm so familiar because this is the theorist that we used for our research, for our thesis. Okay. Nurse Ron is observing a male client using a walker. The nurse determines that the client is using the walker correctly if the client puts all 4 points in the walker flat on floor, puts weight on hand pieces, then walk to it. And right. When the client uses a walker, the nurse stands adjacent to the affected side. The client is instructed to put all 4 points of the walker 2 feet forward, flat on the floor before putting weight on hand pieces. This will ensure client safety and prevent stress cracks in the walker. The client is then instructed to move the walker forward and walk into it. Nurse Linda prepares to perform an otoscopic examination on a female client. For proper visualization, the nurse should position the client's ear by. Okay, so we're talking about. I actually remember this. This is actually different for child and adult. It's actually quite the opposite. So we're talking about the adult. Yeah, pulling the helix up and back. To perform an otoscopic examination on an adult, the nurse grasps the helix in the ear and pulls it up and back to straighten the ear canal. For a child, this is what I was talking about earlier, it's the opposite. The nurse grabs the helix and pulls it down to straighten the ear canal. For a child, you have to pull it down. Pulling the lobule in any direction wouldn't straighten the ear canal for visualization. Okay. Cherry notes down ideas that were derived from description of an investigation written by the person who conducted it. Which type of source refers to this? Description of an investigation. Okay, this is an investigation, by the way. It's like, it's a primary source. Direct account of the investigation done by investigator. In contrast to this is a secondary source, which is written by someone other than the original researcher. I will just answer 30 questions for tonight. I'm starting to get sleepy now. Okay, the physician prescribes a loop diuretic for a client. When administering this drug, the nurse anticipates that the client may develop electrolyte imbalance. Okay, hypokalemia, hypernatremia, hyperkalemia, hypervolemia. Loop diuretic. It's hyperkalemia. It's the opposite. Okay, a loop diuretic removes water and along with it sodium and potassium. This may result in hypokalemia, bulimia, hyponatremia. Yeah, it's true. Hypokalemia, hypovolemia, hyponatremia. Hypokalemia, hypovolemia, hyponatremia. I got it correct. Look at this. This is hypokalemia. That is the sodium, the fluid and electrolyte is being released through the diuretic. That's its mechanism of action. So typically, hyperkalemia is the correct answer, not hyperkalemia. I think the creator of this website just made a mistake on this part of the exam. Okay. Nurse Michelle witnesses a female client sustain a fall and suspects that the leg may be broken. The nurse takes which priority action? Call the radiology department, reassure the client everything will be alright, take set of vital signs, immobilize. Immobilize. If the nurse suspects a fracture, splinting the area before moving the client is imperative. The nurse should call for emergency help if the client is not hospitalized, and call for physician for the hospitalized client. Nurse Monique is monitoring the effectiveness of a client's drug therapy. When should Nurse Monique obtain a blood sample to measure his true drug level? Hmm. Effectiveness of client's drug therapy. Right, it's this one. Because measuring the blood drug concentration helps to determine whether the dosing has achieved the therapeutic goal. For measurement of the truth or lowest blood level of a drug, the nurse draws a blood sample immediately. Okay, we're almost done. Which intervention should the nurse Trish use when administering oxygen by face masks to a female client? Right. By assisting the client to semi-Fowler position, the nurse promotes easier chest expansion, breathing, and oxygen intake. The nurse should secure the elastic band so that the face mask fits comfortably and snugly rather than tightly, which should lead to irritation. The nurse should apply the face mask from client's nose down to the chin, not vice versa. The nurse should check the connections between the oxygen equipment and humidifier to ensure that they're all airtight. Loosened connectors can cause loss of oxygen. Okay, this is the final. A 45-year-old client has no family history of breast cancer or other risk factors for this disease. Nurse John should instruct her to give mammogram how often? Once a year. Yearly mammograms should begin at age 40 and continue for as long as the woman is in good health. Okay. When a nurse is in charge When a nurse in charge causes an injury to female patient and the injury caused becomes proof of negligent act, the presence of injury is said to force majeure. No. Oh. Res ipsa liquidator. Res ipsa liquidator literally means the thing speaks for itself. This means in operational terms that the injury caused by the proof that there was a negligent act. Okay, I will continue this later, tomorrow. So I'll see you guys tomorrow again. Thank you. Goodbye.